Hello, I'm Ashley Martirana, and I will be starting our presentation on anxiety disorders, specifically panic disorder, social anxiety disorder, and generalized anxiety disorders. All right, I want you to stop and ask yourself, have you ever felt your heart race while doing something frightening? The answer is probably yes, and if so, then you have felt something called anxiety. A lot of people ask the question, doesn't everyone experience anxiety? And although the answer is yes, for most people, this anxiety is a completely normal, often useful feeling that happens in a stressful situation where you're usually unsure about the outcome of something. For many people, that feeling that you get when you're doing something that scares you can happen on a daily basis for no necessary reason. That is referred to as an anxiety disorder. There are many different forms of anxiety disorders that we're going to be talking about in this presentation. It's important to note that feeling anxious is normal. That is a temporary symptom of a situation that causes discomfort, whereas an anxiety disorder causes an excessive feeling of worry and fear that is uncontrollable and unexplainable. So going into the definition of an anxiety disorder, according to the DSM-5 section 13.A, an anxiety disorder is defined as excessive anxiety and worry, apprehensive expectation, occurring more days than not for at least 6 months about a number of events or activities such as school performance, work performance. But let's break it down so that it makes a little more sense. It starts off by saying excessive anxiety and worry, apprehensive expectation. When we talk about an apprehensive expectation, usually we're talking about something that is in the future. It's that feeling of impending doom, like something is always going to go wrong. You're expecting the worst in every situation. It usually is occurring more days than not for at least 6 months. By that, it means that these feelings are predominant emotions, and it must occur for at least 6 months or possibly more. And then it also says that these feelings must be happening throughout a number of events. So not just school, not just work. It is something that is causing this throughout many aspects of life. So when thinking about types of anxiety disorders, you can think about the term anxiety disorder as the umbrella term. And then within that umbrella, there are actually 7 different forms of an anxiety disorder. We are going to be talking mostly about the top 3, so generalized anxiety disorder, panic disorder, and social anxiety disorder. It's also very important to note that many of these disorders can coexist, so a person can experience symptoms from 2 separate disorders. So some of the most common types of anxiety disorders are panic disorder, social anxiety disorder, and generalized anxiety disorder, but we're going to start with panic disorder. It affects about 2 to 3% of the population, and it is identified as recurrent, unexpected panic attacks. When talking about a panic attack, it is usually a very sudden but very temporary feeling of a very strong physical reaction to something that is oftentimes very non-life-threatening. Some people describe having a panic attack as feeling like you're having a heart attack, although it is important to note that a panic attack can look different for everybody. Moving on to social anxiety disorder, it affects about 7% of the population. It is identified as marked fear or anxiety about one or more social situation in which the individual is exposed to possible scrutiny by others. So for example, having a conversation with somebody, meeting somebody unfamiliar, being observed while you're eating, being observed while you're drinking. A lot of the times, children with social anxiety disorder do experience these, but it is important to note that a child with a social anxiety disorder, the fear must also happen with peers and not just with adults. It has to be in multiple different settings. And then finally, we're going to talk about generalized anxiety disorder. This affects about 3% of the population. It is persistent and excessive anxiety about everyday activities that do not correlate to the task being done. That just means that these fears that somebody is having are bigger than the task or the activity that they are doing. And it's not focused on a specific trigger. It's not focused on a specific fear, because that would be a specific phobia disorder. For these symptoms, like I said earlier, a lot of these symptoms can overlap, starting with a panic disorder. You can feel palpitations, sweating, feeling of choking, chest pain, nausea, derealization, dizziness, or fear of dying. Remember I said that this panic disorder is causing a panic attack. Moving on to a social anxiety disorder, it is a fear of being negatively viewed. So oftentimes people will avoid a social situation because of it. A physical symptom would be more like blushing or sweating. Moving on to generalized anxiety disorder. There are 6 specific symptoms with a generalized anxiety disorder, and to be identified or to be diagnosed with generalized anxiety disorder, an adult must exhibit 3 out of the 6 of these symptoms. So restlessness, easily fatigued, difficulty concentrating, irritability, muscle tension, and sleep disturbances. However, with children, they only require that one of these symptoms is identified.
So these causes can be for any of the anxiety disorders that we have researched and discussed up to this point. So there's not necessarily one specific cause to an anxiety disorder, but some life experiences may trigger the onset of symptoms. And the causes of anxiety disorder for an individual aren't always fully understood or known either. So there can be biological causes that are related to genetics and inherited traits that can make an individual more prone to an anxiety disorder. So if they have these traits and they're more prone to it and they experience stressful situations in life, then it can trigger their symptoms. There are medical causes, so there's certain medical conditions that can be linked to anxiety. So conditions include heart disease, diabetes, thyroid problems, respiratory disorders like COPD and asthma, drug misuse or withdrawal, and this can include prescription drugs, irritable bowel syndrome, and in some rare cases, there are some types of tumors that can create an anxiety disorder. And they can also be the result of a side effect of certain types of prescription medication. There are also certain risk factors that make someone more likely to develop an anxiety disorder. So trauma, children and adults who experience traumatic events, either directly or by witnessing traumatic events, or those that endure abuse are at a higher risk of developing anxiety disorder. And you may not develop the disorder right away. It can happen later on in life that you start having these symptoms. Stress is also a big risk factor. So, stress from health conditions or serious illness can cause it. So, you can be stressed when you receive a medical diagnosis about like treatment options and what the future looks like for you when you receive that diagnosis, which can then trigger anxiety symptoms. And then also experiencing one big stressful event or a buildup of smaller stressful events can trigger anxiety disorder. So stressful events could include anything from like a death in the family, losing a job, or just any other smaller stressful situations that build up over time. Personality, there are certain personality types that are more prone to developing anxiety disorder. Already being diagnosed with other mental health disorders, so having another mental health disorder like depression can make a person more prone to having anxiety disorder. And then having blood relatives who have an anxiety disorder, as these disorders can run in families, and substance use, so including drug and alcohol use, misuse, and withdrawal from the substances, put someone at a higher risk of developing an anxiety disorder. When diagnosing for an anxiety disorder, doctors will use a screening tool. So this tool for generalized anxiety disorder will ask patients to think about the past 2 weeks and answer on a scale of how they've been feeling and what they've experienced over the past 2 weeks. So the scale gives a rating either not at all, several days, more than half the days, or nearly every day. And then doctors add up, and there's a score from 0 to 21. So a score of 5 is the cutoff for mild anxiety, and that goes up to 10. Then a score of 10 is the cutoff for moderate anxiety, and that goes up to 15. And a score of 15 and above is indicating severe anxiety. So just like when diagnosing generalized anxiety disorder, doctors will use a screening tool to help with the diagnosis for panic disorder. So this diagnostic tool has some general question about your past experience, and then more specific question about your last bad anxiety attack and the symptoms that you experienced during this last bad attack. And then same as before, the doctors will use this rating scale to determine the severity of your panic disorder.
Next, moving on to educational impacts. The different anxiety disorders can significantly impact a student's ability to focus, remember information, and engage socially. Because anxiety can affect so many areas of a student's life, it often prevents them from demonstrating their true academic potential. As educators, teachers, and people working in school districts, it's essential to recognize these challenges and understand how to best support each student's unique needs. This awareness can allow us to create learning environments where anxious students can thrive. One of the first ways that we see anxiety affect students is within their learning in the classroom. Students with anxiety might struggle to concentrate or pay attention during lessons within the classroom. Sometimes their thinking can feel foggy, which makes it harder for them to absorb new information or recall what they have previously learned. Another common thing we see with students with anxiety is testing anxiety, which is especially common and negatively affects students' grades or how well they're doing in school. Anxiety also can cause students to miss school or avoid completing assignments, which also further impacts their academic success, making their grades drop if they are not doing well on tests, passing in work, or not showing up to school at all. Next, moving on to social and emotional. Anxiety doesn't just affect a student's academics, but it also can affect their social and emotional functioning within the classroom setting. Many students with anxiety find group work or working with peers that they aren't friends with or don't know well to be very challenging. Certain classroom topics and conversations can also trigger students' anxiety. Students often have difficulty managing strong emotions. This can influence their behavior and interactions with other students within the classroom. An important thing for us educators or people working in the school districts to do is to understand these social and emotional challenges that our students may be going through and find out how to best support their students overall. Many times when we think about educational implications, we just think about a student's grade or how they are working with content within the classroom, but it runs deeper to how they function within the classroom setting itself and how they can interact with their peers as well. How can we support students? So there are many different ways that teachers, educators, anyone working in a school district can help students with anxiety. The first one would be creating a safe and welcoming learning environment. If students feel comfortable with their teachers, with their classmates, and in the classroom, it's going to set them up to be more successful. It's important to allow students to access their counselors or adjustment counselors for additional support. As teachers, we try to implement students with different coping strategies to help them within the classroom, but sometimes it's best just to send the student to a counselor or student adjustment counselor to get the support they need out of the classroom. Offering accommodations like extra time breaks and just helping students manage their anxiety during tests and lessons is helpful as well. Getting to know a student's IEP, their accommodations, their modifications, and giving them what they need even if they're not asking for it. A lot of times a student with anxiety may not feel comfortable raising their hand and reminding you of an accommodation they have. So just getting to know the student in front of you and what they need so you can tailor your supports to them specifically. Lastly, some practical strategies that teachers and educators can use every day in their classroom are: 1. Incorporating mindful exercises and maintaining structure routines within our classroom to provide predictability. Many students with anxiety struggle when they do not have a set routine, so allowing the students to know what's coming next can lessen their anxiety. Having a calming classroom environment and even a calming corner if you teach the younger grades. If you teach middle school or high school, maybe just allowing students to take a break when needed. Checking in with your students regularly and focusing on building these strong relationships with them so they feel comfortable to reach out to you when needing support. Also, encouraging positive self-talk and setting achievable goals within our classroom, modeling this for our students, allows them to see the coping tools used and how they can use them themselves. Providing choices for students, so allowing them to work alone if they do struggle socially, instead of working with others if that's available. And also not hesitating ourselves to refer students if they need additional support that we cannot give them within the classroom. Reaching out to their counselors, to special ed representation, or anyone else in the school that can provide the student the needs that maybe we cannot give them within our classroom.
So in our research, there were two recommended treatments that we primarily focused on. These are two primary paths. Number one being evidence-based medical approaches, and then the second being these empowering educational strategies. If we begin on the medical side, SSRIs are key. That's short for selective serotonin inhibitors. And we have found that they're first-line medications that help balance a person's brain chemistry, and then they essentially turn the volume down on persistent anxiety. And then we also see CBT, or cognitive behavioral therapy, which is, according to research, the gold standard for talk therapy. It's highly structured and focused on challenging irrational thoughts and behaviors. And on the other side of things, we have this educational column that really discusses the long-term management that a patient or a person can benefit from if they struggle with an anxiety disorder. And this can include psychoeducation, so it's understanding the fight or flight response and then using skills like mine that a patient or a person can benefit from if they struggle with an anxiety disorder. And this can include psychoeducation, so it's understanding the fight or flight response and then using skills like mindfulness and deep breathing to physically counteract anxiety symptoms. And then it crucially emphasizes lifestyle adjustments like consistent sleep and avoiding caffeine, which directly influence anxiety levels. We are aware that there may be millions of things or thousands of things that may or may not work, but these are the ones that we found in our research that were most beneficial or were most effective. And we mentioned other examples, one of them being support systems, which is engaging in support groups or individual counseling that focuses on building a network of people who understand the experience. They help reduce isolation and then they improve in social coping strategies. If you would like to know more, we do go in depth on our slide where it talks about how we can be supportive to relationships for anyone who is struggling with that anxiety disorder or any patient that is struggling with that. So in our group project, we wanted to include a case study because we believe that it's important for us to have examples or to have something to look at when we're thinking about anxiety disorders. And so we have George, who's a 23-year-old student. He presents a combination of social anxiety, he presents panic attacks, and he presents a specific phobia of heights. And all of these really do illustrate the complexity of anxiety disorders. And if you look at his symptoms, you notice how his fear of physical symptoms like palpitations creates almost a secondary fear of losing control or going mad. And although this is common among patients with these kinds of disorders, it can be very highly distressing for them. If you look on the other side on the treatment connection, his treatment uses CBT principles, which is cognitive behavioral therapy, and we just went over that in the last slide. And for him, the focus is on two things. Number one, it's cognitive restructuring to challenge his fears of driving or social situations or settings. And then there's exposure therapy, which is used to help gradually face those fear situations and to build mastery over his symptoms. And we provided the links to this case study so that people can get almost a deeper understanding of what this can look like in a person and how complex and how different it can look. So when talking about or discussing support in relationships with individuals or patients who have or who struggle with these disorders or who are facing these disorders, we mentioned a couple because we understand that relationships are significantly impacted by anxiety, but our role is to offer support that promotes recovery and not dependence. One of the first things that we wanted to mention was education and empathy. First, education and empathy, because it means we understand the disorder and we understand that it prevents us from dismissing their fear and how important it is to validate a person's feelings. One example is really just saying, I see you're anxious, not just get over it, because it's not something small or insignificant. It's not just a feeling that they can get over in 1 second, but it's something that they're truly experiencing. Another one is communication, because it's important to have clear communication strategies. And this may mean talking openly during calm times, listening actively, and using I statements to express your own needs without placing blame on the person or on their disorder. And then there's also collaboration. So it's important to have that collaborative support. And that may mean gently encouraging treatment and celebrating small wins. But always remembering that that is your partner or your friend or your family member and that you are not their therapist. And I think that that's a big one. It's understanding that you really aren't their therapist, but you are somebody who is there for them, and you're encouraging treatment. You're part of that collaborative support. And then the last one that we talked about was boundaries. So it's important to set boundaries and self-care because it's essential. So it's important to avoid relationship accommodation, and that just means letting anxiety dictate all decisions, and instead just setting clear and kind boundaries to protect your own well-being as well. So the reason why we wanted to mention these in specific was because we kind of want to understand both perspectives of those who are struggling with the disorder, but then those who are around that disorder and those who are part of that collaborative team.